We'll hear from a Manchester councillor.
Yeah, and you.
No way, so bad.
A little exercise is good for all of us, particularly if you've had cancer. It will reduce the side effects of treatment and can even help prevent some cancers returning. But you don't need to run a marathon.
You got fig rolls? Oh, Joe. Hurry up, because I'm starving.
Just a short jog or brisk walk to the corner shop can help.
As you saw from that video, rest really is not best. You may have a cancer diagnosis, but that doesn't mean that you now have an excuse for not exercising. The days when we would say, oh, you're poorly, rest up, those have gone. What we will be doing throughout your treatment is encouraging you to remain as active as possible. This doesn't mean that we want you to embark upon an Olympic training regime. No, far from it. What we want you to do is maintain your current level of fitness and, if possible, build on that slowly and steadily. The fitter you are at the start of your treatment, the better you'll respond to treatment, the fewer side effects you're likely to suffer, and the quicker you will bounce back. So when we talk about exercise, what exactly do we mean? Where to start with your exercise programme? We would recommend trying to do 2.5 hours of moderate intensity activity per week. This could be just in small bursts throughout the day. It can be things as simple as sit to stand when you're sitting at your dining room table or in your living room watching TV. Short walks, a walk around the block. So if you already do that, keep doing it. Maybe extend your walk and go a little bit further, or you could try doing it a little bit faster each time. There are various exercises you can do whilst you're watching TV. These include picking up a couple of cans of something like baked beans so that you can do some arm exercises whilst you're sitting comfortably in your chair, and you can do that whilst the commercials are on. The other thing that's quite good for getting up your steps is walking up and down the stairs throughout the day. A little tip there is, rather than saving everything up that needs to go upstairs and doing one trip at the end of the day, every time you have something that needs to go upstairs, take it upstairs and come back down again. When you have something else, do another trip. So at the end of the day, you'll have racked up a good number of steps, 10 times more than if you just did that one trip. A very simple but effective tool that you can use at home is one of these. This is an exercise band or a resistance band, and there are a multitude of exercises you can do with this. We do have a sheet that we can give you, but the main thing is just to build it up slowly and make sure that you're not doing anything that's contraindicated with your cancer diagnosis. Another reason exercise is important is that when you become inactive, muscle fatigue, muscle wastage and joint stiffness set in really quickly. So we'd encourage you to do whatever you can just to keep moving. Remember, rest is not best. We're very lucky to have a number of specially trained fitness instructors. Some of these are affiliated to the support groups that we mentioned earlier. We have CFIT, who are affiliated to the Seasiders, the Weymouth and Portland support group. We have Stepping Out, who are affiliated to the Living Tree in Bridport. And we have Luke Hayter Fitness, and he's a very enthusiastic young man who does specially designed cancer rehab sessions. In addition to this, if a gym is not your thing, there are many Walking for Health groups that meet locally, and these can be found by looking online. The emphasis really isn't on hard activity. It's more important just to keep active, get out there and keep moving.